Hi, everybody. Yes, Dr. Sandy Colvard. I currently work at the University of California at Irvine at the Susan Samueli Integrative Health Institute. I have previously worked in private practice. I have done primary care work as well as oncology work. My other specialty is anxiety, depression, and grief. So I am so pleased to be able to come here today and talk a little bit about lymphoma. I got my start working in oncology at Cancer Treatment Centers of America, first the hospital in Philadelphia and then the hospital in Georgia. And that's where I got a lot of my hematologic cancer training. So let's just jump in. And please feel free to ask questions. And if I can answer them, I certainly will. And if I cannot, I will find an answer for you. A good one. So integrative medicine, perhaps many of you are very familiar with integrative medicine, but the official definition of integrative medicine is a form of medical therapy that combines practices and treatments alternatively with conventional medicine. The NIH actually has a National Center for Complementary and Integrative Health. It does make a distinction between complementary, alternative, and integrative medicine. Complementary is what they call non-mainstream. I'm not sure that I would call it that, but a non-mainstream approach together with conventional medicine. Alternative is the approach used in place of conventional medicine, and integrative brings them together. That's exactly what I like to do. My favorite thing to do is to work with medical oncologists, radiation oncologists, even primary care doctors and other doctors, acupuncturists, all together, because I think that that's what makes the best result for the patient, because at the center of this all, it should be about the patient. So integrative medicine, again, taking these definitions from the different governmental websites, it emphasizes a multimodal treatment. In other words, we're using more than just one intervention to treat the patient. So we could use medication, chemotherapy, physical therapy, supplements, yoga, acupuncture, et cetera, et cetera. So we want to treat the whole person. That's the important part. As a naturopathic doctor, that's my job. I want to treat the whole person, not just the symptoms, not just the disease state, but everything about that person. We want to restore health. We want to restore your well-being. We're going to look at everything, not just your physical symptoms, but what's going on emotionally or psychologically, environmentally, et cetera, et cetera. And hopefully it's a well-coordinated care between the different providers. So integrative oncology is a little more specific. We emphasize this first line. Integrative oncology provides patients with safe options for combining conventional cancer treatment with natural and supportive therapies. There's so much information out there. My job a lot of the time is just making sure that everything that the patient is doing, let's talk about, where did you hear it from? Is there any research to back it up? Is this safe to take either with your chemotherapy, with your treatment regimen, with your immunotherapy, and then after treatment is over, let's make sure everything is safe and is going to support you the best way you can. And again, it's all about collaboration. And you probably are already aware of this. The survey, now this is a survey from the year 2000, that 80% of people with cancer use some form of natural medicine. My guess is it's still 80% or perhaps more. So naturopathic doctors work with patients receiving conventional treatment for cancer. So my training really does include nutrition, all of the supplements, whether it be vitamins, minerals, amino acids. A lot of the botanical are also called herbal medicine. I am trained in physical medicine, which is very similar to chiropractic, although I don't use it right now in my practice in California. It's not part of my scope of practice. I talk to people a lot about movement or exercise. I tend not to use exercise because it seems to be a dirty word sometimes. So let's just talk about movement. Are you moving your body? I talk about, counseling and mindfulness. So my goal, as always, is to improve the quality of life, mitigate or manage any side effects, enhance your recovery from the treatment, and let's lower that risk of a reoccurrence of the cancer. And of course, always, always healthy lifestyle. So again, this is just saying this in like 10 different ways. All providers work together to improve the patient's quality of life. And then when I do work with a patient, I can work with them at any stage of their treatment, whether it's right at diagnosis. I do see people that were pre-diagnosis. Let's talk about your healthy lifestyle. Then I talk to them at diagnosis. How do we prepare for treatment? Let's talk about everything that's involved. Did you understand everything that your oncologist told you? Can I help you in any way to understand this better? When people are going through active treatment, let's talk about the side effect possibilities. Can we help to get those side effects to be less or to not be there at all? And let's support you in the whole person. Let's support you in every aspect of your life as much as possible. And then after treatment, we want to support recovery from treatment and reduce any risk of recurrence. So this is, the standard definition of naturopathic medicine. It's a distinct primary healthcare profession, emphasizing education, prevention, treatment. So we are trained as naturopathic doctors in our medical school to be primary care providers. We are trained to open up a practice to be a primary care provider or work with other doctors. Then those of us that are interested will get certifications or additional training or residencies in other areas. And mine happens to be oncology. And then the last bullet here, the therapeutic care varies by state and territory. So every state, every place does have its own scope of practice. So, when I'm in California, what I'm able to do and not do is different than when I was in Arizona, which we had a full scope of practice, or Vermont. I have practiced all over the country, so I'm very familiar with the different scopes of practice. So a naturopathic doctor does get 4 years of training at a medical school. And, I didn't mean to do that. Let me go back a bit. And let me see if I can get that to close. It's not closing for me. Hang on just a moment, folks. Sorry about that. Okay, 4 years at a medical school. We get all the training. Our first 2 years are essentially the same as a medical school, a traditional medical school. Our second 2 years is when we really start to dig in to a lot of the alternative treatments, such as herbal medicine, homeopathy, other things that go along with that. Right now, 26 jurisdictions, so 23 states plus the District of Columbia, Puerto Rico, and the Virgin Islands have licensing or registration laws for the naturopathic doctors. The naturopathic doctors have a naturopathic oncology association. So they define naturopathic oncology as the art and science of naturopathic medicine toward the cancer patient. Well, that makes perfect sense, doesn't it? So the naturopaths trained in integrative oncology, again, the first bullet, it's all about safe therapies. When you have a diagnosis, no matter what that diagnosis, you are getting information from all different places on what to take, and this is going to cure this, and this is going to do that. Your naturopathic doctor who is trained in oncology, I spend a great deal of my time either on the clock or off the clock, reading about new treatments and what's good and what's out there and what's the latest thing on Google, what's the latest thing on Instagram that are telling people this is what they should take for their cancer. And I need to research that and see, is it good or should people avoid that? So I love this. This visual is from the Oncology Association of Naturopathic Physicians. I love this because this is how I see cancer care. The center is always, always, always the patient. The patient is the focus of everything we do, or in my opinion, it should be the focus of everything we do. So then surrounding the patient is the conventional treatment, whether it be radiation, chemotherapy, immunotherapy. Those are the folks that are say, okay, let's attack this cancer for what it is. Then up here, we have the naturopathic doctor, where we're trying to support and reduce the side effects and help you get through the treatment as being as healthy as possible. I would also probably, from my experience, include other practitioners in this part of it, but just focusing on naturopathic doctors, that's what we do. And then the whole umbrella of integrative oncology, including, acupuncture, chiropractic, oh my goodness, therapy, physical therapy, social workers, psychiatry, all of this is all involved in this bubble. But most importantly, it's the patient. That's the important thing here. So to have advanced training of a naturopathic doctor in oncology, we have to do a lot of things to become what's called a FABNO, or a Fellow of the American Board of Naturopathic Oncology. That's what I have done. And so here are the requirements to get that certification. You either have to have a 2-year residency, or you must have been in practice for at least 5 years and have over 2,400 oncology patient contact hours. I did not have a naturopathic residency. I went right into private practice and did primary care work for a number of years before I got into oncology specifically. But, I kept getting oncology patients, and I listened to what the universe was telling me. So that's when I really started to concentrate on oncology. And then, of course, we have to pass a rigorous board exam, because you can't get a designation like that without passing an exam. That was a very long 4 hours of my life that I spent taking that exam. And then, of course, we always have to maintain continuing education requirements. And that's the logo of the Oncology Association of Naturopathic Physicians. No matter where you are in the country, I'll just put a plug in for them. You can look up that website, and they have a Find the Doctor tab. So you can look in your state or in your area and see if there's someone close to you that you would like to consult with. And if at all possible, if you can get someone with the FABNO designation, that's great. If there's somebody on there that doesn't have the FABNO designation, that doesn't mean that they're not good at what they do. They just haven't, finished up their, 2,400 patient contacts or passed the board exam yet, whatever the reasons are. So what do I do in integrative cancer treatment? I support the immune system. I want to improve the immune system's ability to naturally protect and fight against the cancer in the body. And I want to keep all the blood counts at the level where you can continue to receive your chemotherapy, if that's what you're receiving. So I don't want, once the white blood cell count gets too low, once the platelet count gets too low, then chemotherapy will have to stop for a period of time. Well, we want the chemotherapy to do its job. So part of my job is supporting the immune system to make sure that those counts stay up there, so you can get your treatment and get the treatment done in the intervals that it should be done. So I also work with patients to reduce or eliminate cancer promoting conditions. So lifestyle. Most of my work is with lifestyle. I want to talk about movement and exercise. What's the level of stress? What can we do about that stress? What's your emotional life like? Is there anything we can do to support you? That's why I have that secondary specialty in anxiety and depression. Let's talk about that. And possibly reduce toxin exposures. It's really difficult. I can't tell you, move from where you are because you're near some toxic plant or any of that. And that just really kind of leads to the idea that you did something to cause this cancer. You didn't do anything to cause your cancer. Let me be really clear about that. You have a condition, you have a disease. Let's work on getting you better from that. I always talk to my patients about improving diet and nutrition. And if there are any nutrient deficiencies, if we check for this doing labs or anything that the oncologist labs have shown me that there's something deficient, we're going to work on improving that. Because anything we do to improve your nutrition and your nutrient deficiencies, it's going to help you in your work against the cancer. And of course, as I've said multiple times, I'm going to reduce the chemotherapy and or the radiation side effects. And if it's possible, and it is possible in some cases, to use supplements and to use vitamins or minerals or herbs that will enhance the effectiveness of any treatment that you're receiving. So this is the Lymphoma Research Foundation. So let's talk a little bit about lymphoma. Lymphoma is different. Lymphoma is one of the hematologic cancers. So this is a de facto a cancer of the immune system. It's a cancer of the circulatory system, the lymph system. So there's several different forms of, I mean, even within the lymphoma, there are different forms of lymphoma, but there's also leukemias and myelomas. And in each of those, we have to look at it very differently, because even though they're all hematologic cancers or blood cancers, if you will, we have to treat them differently because they all have little nuances that we have to be aware of. So because lymphoma is a cancer of the immune cells and the immune system, I have to use different treatments from what I would do for somebody with a solid tumor. The general, idea in a solid tumor is let's support the immune system. Let's get the immune system up there and fighting. But for lymphoma, I can't really do that. I have to be aware of the immune system in lymphoma. So how am I going to support your immune system without overstimulating the immune system so that it makes possibly the lymphoma get worse? So there's a lot of different supplements, a lot of different nuances that we do to make sure that we're supporting the immune system without overstimulating the immune system. Every time there's a new treatment that comes out, every time there's a new drug or a new thing, I research and my colleagues research everything that comes out so that we know what's there, in particularly in all the new supplements, because supplements are everywhere. You can, Google them, you can find them on Amazon, you can do all these things, but we want to make sure that what you're taking is not going to be harmful. And of course, we want to reduce the side effects of chemo, which I've said now like 10 times. So why does lymphoma happen? So, there's many different answers to this, but one of the basics things is that toxins or some sort of a chronic stimulus or chronic inflammation can lead to the development of lymphoma. So chronic antigenic or stimulation of the lymphocytes in the body could result in those lymphocytes proliferating or getting more of them and then developing lymphoma. An antigen is any substance that your immune system uses to produce antibodies against it. So, of course, during the pandemic, we've learned a whole lot more about antigens and antibodies. So an antigen presents to the immune system reacts to it by producing and making antibodies against it. So an antigen can be something from the environment, such as chemicals, bacteria, viruses, pollen. An antigen, somebody with a lot of bad seasonal allergies, the goldenrod or the dust mites or whatever is the antigen that's presenting to the body. And the body, in trying to fight off that antigen, is what's giving you the runny nose and the sneezing and everything else. And of course, any underlying chronic viral infections can also contribute to this. There's a lot of information out there about pesticides and exposure to pesticides leading to the possibility of lymphoma. So the organochlorine pesticides, the OCPs, could increase. They were used a lot. I mean, a lot of my older patients, anybody who was exposed to DDT as a child has the much greater possibility of lymphoma. And then the World Health Organization in 2015 found enough evidence to reclassify the glyphosate as a carcinogenic. And glyphosate is Roundup. It's what everybody sells it and everybody still uses it, but it is carcinogenic. The other thing that can cause some issues is leaky gut, or what we call intestinal hyperpermeability. I think leaky gut's a lot easier to remember. So, our digestive tract, this is where we break down food. That's where we get our nutrients. We're absorbing everything. The digestive system is also protecting your body against harmful substances. So the walls of the intestines are barriers, and they control what enters the bloodstream to be transported to your organs. So if there are gaps in the intestinal wall, they're small gaps. They're called tight junctions. They're supposed to be there. They allow water and nutrients to pass through, and they block the harmful substances. So intestinal permeability refers to how easily a substance can pass through that intestinal wall. When there's chronic inflammation, when we're eating something that is causing inflammation in our body, or we have a condition that causes inflammation, those tight junctions become loose. So then the gut becomes more permeable. Then bacteria, toxins can pass from the gut into the bloodstream. And that's why we call it leaky gut. So when the bacteria and the toxins enter the bloodstream, it causes widespread inflammation and can trigger an immune response. So this is a big one. So those folks who have actual celiac disease, this is a good example. If they don't avoid gluten, they don't avoid gluten-containing products, the breads, the pastas, et cetera, the constant irritation to the lymphocytes in the GI tract can cause lymphoma. So in anybody, as this second bullet says, overall, the patients with celiac disease had an annual lymphoma risk of about 68 out of 100,000 people, which is 3 times higher than the general population's risk of intestinal lymphoma, which is 24 out of 100,000. So all of my celiac patients, I just tell them, we have to avoid gluten, period, end of conversation, because we don't want to, come up with an intestinal lymphoma at some point in the future after years and years of inflammation. So how do I treat lymphoma? Modulate, not stimulate the immune system. This is the biggie. We have to be so careful about what we're doing and how we're doing it. I have certain supplements that I use on a regular basis. I know those supplements which are proven to help modulate the immune system, but not overstimulate it. We want to decrease any antigen exposure, as we just talked about. Absolutely have to improve the digestion. We want to find out if there's any food sensitivities, even if it's not a frank allergy. If you eat, I don't know, dairy, for example, and you find out that you are congested after you eat dairy, that could be an issue. We need to take a look at that. And we also need to look at the GI tract and improve the absorption so that you're really getting the nutrients. It doesn't do us any good to be eating a really good diet if our GI tract is inflamed and we're not getting the benefit of the nutrients that we're actually taking in. And absolutely, with lymphoma, we have to utilize stress management techniques. So looking at mindfulness, looking at meditation, talking about, spirituality, talking about, anything that we can do to make that stress response better. And of course, I use a lot of supplements and other strategies to reduce inflammation and support overall health. So everybody wants to talk about nutrition, right? So my favorite diet, and the diet that I talk to most people about, is the Mediterranean diet. So the Mediterranean diet is what I like to call plant forward. There's a lot of talk today about, plant-based diet and being vegan and being vegetarian. Well, what I have found in my career and in my experience is that not everybody is meant to be a vegan or vegetarian. Some people, depending on your genetics, depending on so many things, really do need some animal protein. So what the Mediterranean diet tells us is plant forward. So the bulk of the Mediterranean diet is plants, it's veggies. So let's look at the veggies, look at the veggies, get a diversity of vegetables in there. Extra virgin olive oil is a healthy oil. There's a lot of oils out there that say they're extra virgin olive oil that they're really not. So there's some information about what are the real olive oils and what aren't. You can always go to the Environmental Working Group and look at their list of what's the good oils and what's not the good oils. That's ewg.org. So, and then we've got fish, whole grains within reason. We have to be aware of how much gluten we're taking in, because even if we're not allergic to gluten and grains, processed grains, especially the way they're done in our country, can be detrimental. as it says here in the next sentence, the high glycemic index rating of North American grain products. What does that mean? That means the grain products in the United States have a higher sugar content. So I know people that are sensitive to gluten that can actually go to Europe and other places and eat the bread, and they don't have any reaction like they do in our country. I like to tell people to restrict or minimize the grain portion of the Mediterranean diet, but it's all about the veggies. So we've got a lot of vegetables, a little bit of fruit, and then smaller portions of meat. We were never meant to go to a restaurant and have a porterhouse steak that took up the whole plate. We're supposed to have smaller portions of meat and really emphasize the vegetables. And I like to say eat the rainbow because, you know, I don't know about you, but when I was growing up, and I grew up in the country, I was in Kentucky. That's where I grew up most of the time in my childhood. And we would have, if you looked at our plates, it was like, oh, a piece of chicken and some potato and something else. And it was like if you look at your plate and it's all white or it's all beige, there's nothing fun about that. So really think about what are the things that you can put in your diet, that you can put on your plate that's pretty. You want green lettuce, real bright greens, and red radishes and red tomatoes, and purples and oranges, the peppers and all of that. Really think about that, because that's giving you more nutrients every time you eat that way. There is a lot of evidence, a lot of research that suggests that all of the hematologic cancers respond really positively to carbohydrate restriction. So again, we're maintaining a high veggie, clean foods, organic foods diet with low glycemic foods, so fewer grains, fewer starchy veggies like potatoes, even though I love them. And intermittent fasting is something really important. There's lots of information out there about intermittent fasting. I tell all of my patients, if you haven't done it before, start with a 12-12. That's 12 hours of fasting and 12 hours of eating. This is essentially what we do anyway. Like when we're sleeping, that's fasting. We're not eating anything. So, and then you work your way up to perhaps a 16-8, 16 hours of fasting, 8 hours of eating. And some of the research shows us that women tend to do better with their eating hours starting later in the day, say about 11 a.m. to 12 noon, and then going to 7 p.m. or 8 p.m., and that men seem to do better when they eat earlier in the morning, and then they stop their eating earlier in the late afternoon, early evening. And when I say fasting, you're allowed any non-caloric liquid. That includes black coffee, water, teas with no sugar. I always add in bone broth. Now, those of you that are paying attention, the bone broth does have calories. It is not a non-caloric liquid. However, when you're first starting out to do intermittent fasting, I really want people to pay attention to how their blood sugars are. If you're not used to fasting and you get low blood sugar and you start feeling, shaky, or you get sweaty, or you get hangry, as we like to call it, a little sip on some bone broth is just going to help ever so slightly to get you out of that low blood sugar place. We want to ease you into intermittent fasting. We don't want to just throw you in there and have you not feel well. The other thing that we know is important with lymphomas is the cruciferous vegetables. The cruciferous vegetables are also great for breast cancers, prostate cancer, and other cancers. But we know that the organic veggies from the cruciferous family, they're also called the brassica family, they should be added. This is all the kale, cauliflower, Brussels sprouts, broccoli, kohlrabi, turnips, the greens, the collards and the mustard greens, cabbage. So all of these things are very important to take, and they're really helping with lymphomas as well as some other cancers. Supplements with lymphomas, leukemias, myelomas. I really do suggest strongly that you see a qualified practitioner, a naturopathic doctor or someone else who's really knowledgeable with supplements. There's a lot of conflicting information out there. Some people say the supplement is okay. Some people say the supplement is not okay. And sometimes the oncologists and I will actually disagree on what is a good supplement and what not. And, I am not going to argue with an oncologist. We're both there for the same reason, to support the patient. So it's, if I can have a conversation with the oncologist and tell them what the supplement is and what it's doing and give them the ingredients and show them research, we usually come to good terms about that. So just make sure that whoever you're talking to, don't get your information from the internet. Don't do Dr. Google, as much as it's so tempting to do that. And there's a lot of folks now that are on Instagram and other places that are just telling you all of these supplements you should be taking. It's not always true. They don't always have your best interests at the heart of what they're doing. I always tell my patients, if somebody's telling you you must buy their brand of supplement, if somebody wants you to sign up for regular shipments, if something is a multi-level marketing, these are red flags for me. And you should really check with somebody before you spend your money. Once upon a time, I had a patient come in to see me who brought in a bottle, and I don't recall the name of the product, but the bottle cost this woman $200+ a month. And I had never heard of this product before. And so when I did my research in it, I found out that there were only 3 ingredients. And I could get this patient all 3 of these ingredients at a higher quality of the vitamins for about $27 a month, which made a huge difference. Nobody wants to spend money unnecessarily. All of the supplements you take should be tailored to you. Everybody's different. When I get a cold, maybe I sneeze. When you get a cold, maybe you cough. Some people get chills. Some people get fevers. We have to know about you. That's why in my intake, I do a very extensive intake with all my new patients to find out everything I can about you and then review all of your labs and all of your history. These are some of the basic supplements that I know are safe in lymphomas. Vitamin D3 has been proven time and time again to be very safe in every cancer that there is, but particularly lymphomas. It stimulates what we call apoptosis. Apoptosis is cell death. It helps to suppress cancer cell growth and helps to regulate immune function. We were actually using vitamin D3 during the COVID pandemic to treat people. Very high doses of D3 in other countries were given IV to help people recover from the virus. So we know that D3 is incredibly important. And if you're taking D3, I do recommend a minimum of 5,000 IUs a day. If you're doing 5,000 IUs a day, then I do recommend having your blood drawn every 4 to 6 months just to see what your D3 levels are. The omega-3 fish oils are very anti-inflammatory. In one study, people with lymphoma, they were randomized to receive 2 grams of fish oil for 9 weeks. And those receiving the fish oil had very big improvements in their inflammatory markers and their long-term survival from their lymphoma. 2 grams of fish oil, that's basically what I give everyone. I give between 2,000 and 3,000 milligrams, which is 2 to 3 grams of fish oil for most of my patients because it's just so helpful as an anti-inflammatory. A lot of probiotics are very helpful. They help the immune system function better. They help your GI tract. They help you digest your food better. It reduces inflammation. However, if your white blood cell count gets too low, if it gets below 2.5 or lower, I stop the probiotics because I don't want to be introducing any sort of bacteria, because that's what a probiotic is a good bacteria. I don't want to introduce any bacteria into your body if the white blood cell count is that low, because that means your immune system is being lowered, and we don't want to possibly cause any issue. I have never seen an issue happen, but theoretically it could, and I'm very conservative because, again, it's all about the patient. I love curcumin. Curcumin is from the spice turmeric. It's what's used in curry powders. It's an antioxidant in some ways. It's an anti-inflammatory. It is so anti-cancer. I use it in almost all my cancers and cancer patients, and it is very well proven and researched to help with lymphomas and other hematologic cancers. Green tea extract, very good. It contains the EGCG. It's an antioxidant. It is postulated, and some research shows that it protects against DNA damage. In some studies, it did inhibit cell proliferation. In other words, it prevents the growth of the cancer cells, and it induces apoptosis or cell death of the cancer cells. And then there was this one large study that I thought was worth sharing with everyone. Compared with participants who consumed less than 1 cup a day of green tea, those who consumed 5 cups a day or more, now that's a lot of green tea because green tea does have caffeine, but those who consumed 5 cups a day or more had a 42% lower risk of hematologic malignancies and a 48% lower risk of lymphoma. Lymphoid neoplasm simply means lymphoma. So like I said, green tea does have caffeine, so we have to be aware of, is the green tea so high in caffeine that it's affecting you? Some people are very sensitive to caffeine. Reishi mushroom, one of my favorite mushrooms. Reishi mushroom is actually a true adaptogenic herb. What does that mean? That if something's too low, it brings it up. If something's too high, it brings it down. It's a modulator. It's not going to overstimulate the immune system. It's going to support the immune system. It's going to balance the there's something called inflammatory cytokines. So if it balances them, it's going to pull back on them. It's going to reduce the inflammation in the body. And some of the research is actually showing that the reishi mushroom in particular destroys the lymphoma cells and even other heme cancer cells, such as leukemia or myeloma. Melatonin is a hormone, I'm sure you've heard of it, to help with sleep. It's produced in the pineal gland of the brain, but it does stimulate the immune cells. So I cannot use, and I do not use, melatonin with myelomas, for example. But in lymphoma, it has been studied extensively that it is safe to use with lymphoma patients. So there's lots of studies. Every type of cancer I do, every time I give a talk on different cancers, exercise and/or movement is very important. So if you look at the benefits of physical activity, there's this one study, 122 people with Hodgkin's and non-Hodgkin's lymphoma. They found that cardio activity improved physical functioning, quality of life, and including those having chemotherapy. We have this image of chemotherapy where we're just so tired and we don't feel good. And I have found that if I can get people to move just a little bit, even if it's a walk around the block, even if it's a walk down to the end of the driveway to get your mail and back, that little bit of movement actually helps you feel better. So there was a lot of information here. There was 44 studies, reduced cancer-related fatigue in people who did moderate physical activity, including some, bone strengthening, some strengthening activity. So a little bit, but working with a practitioner, we're going to see, how are you feeling? What's going on in your body? How are you feeling? And what can we do to not tire you out? But what can we do to do a little bit of physical activity that's going to give you the energy and help your body be able to fight what's going on? I loved this. The 10 studies of people with blood cancers, including lymphoma, were in the hospital having a stem cell transplant, but they found that doing the exercise, they have found a lot of improved heart and lung functioning in those who were doing physical activities before they went into the hospital before their transplant. And of course, all of the studies, they say that people with any type of cancer, and particularly hematologic cancers, there's a reduction in fatigue if they can do the exercise. And even, like I said, even walking down the street is not a bad thing. Self-care. This is a big one, isn't it? self-care and stress management. The world is so full of things to be fearful of, and we hear it all the time. But I want you to be aware of self-care. It's so important. There have been so many studies about doing mindfulness and self-care that help with more positive outcomes in any cancer diagnosis. And I want you to think about this first line here. Self-care and stress less are not the same thing. It's become really easy for people, to look at one another and say, "Oh, let it go, just stress less." It's like a little catchphrase, a little meme, that people put on your wall, on Facebook or other social media. Stress less is ridiculous. You can't just say to somebody, "Let it go," or "stress less," without doing something to help. So I consider self-care is actively adding something positive to your life. So is that something positive, like, I don't know, getting a massage once a week? Is it reading a good book, away from everybody and having that quiet time? Is it adding a meditation practice or something like that? What is it that you're doing to add something really positive into your life? Stress less. How can we take something negative away? Now, we can't take away the diagnosis, but what if we were able to do things that were going to help us fear less about the diagnosis? Again, whether it's meditation, whether it's therapy, whatever it is that works for you, and everyone is different. And when I say self-care, I really mean this. Take time for yourself. It's okay. We're not taught this, but it's okay to be a little selfish. Meditation, what's now termed forest bathing. Basically, it's walking in the woods and being outside and taking in the energy from being outside. I've been telling people to do this for years. I should have made up the name forest bathing a long time ago. Then maybe my student loans would be paid off. So anyway, massage therapy, have a spa day. Even if it's a home spa day where you're doing your own mani-pedi or taking, putting some Epsom salts and some, nice bath salts into a tub and just sitting in the tub, whatever that means for you. Journaling, a lot of people love to journal, reading, listening to music, binging something on Netflix. It's okay. You can do that. And some of the things that particularly the pandemic has gotten in the way of, having a heart-to-heart with a friend, going, for a walk, exercise, a bubble bath. I've already said that. But the heart-to-heart with a friend, we were never meant to be hermits. And sometimes I suggest to people, instead of saying, because we always say, let's go to brunch, let's go to lunch, let's go to dinner. What if you actually had like a friendship walk? You met each other and you walked along a path somewhere, or go walk around a lake, or if you're near the ocean, go to the beach. Sometimes that's a whole lot better than sitting down and eating at a restaurant. Not that restaurants aren't bad. Stress less. Again, I've already said this. Don't ask somebody to stress less. If you're a caregiver, please don't tell the patient to just stress less and not be fearful. That's not helpful. We need to figure out what is going to help them to take away or reduce their stressor. Mindfulness, sleep is a big one. We have to get good sleep. And when it's needed, mental health professionals, I'm a big believer in therapy, and I think that everyone should at least have the experience once in their life. So thank you all for listening to me. In summary, what I do in integrative oncology, particularly with lymphoma, is evidence-based natural therapies. And that's the important part. Everything is safe. And it's patient-centered. You are the most important person. You are the one that should be listened to and talked to and listened over and over again and help you in whatever's going on with your case, with your condition. Integrative oncology should be team-based and collaborative whenever possible. The patient is always the individual. When I do an intake with everyone, I do all the basics, what supplements are you taking? What medication are you taking? all of that, what's your cancer history? But then I'm going to ask things about how are you feeling physically? What's your typical diet? How much water are you drinking? What about your bowel movements? How's your sleep? And then I'm going to ask about mental, emotional things. Is there anxiety or nervousness or depression or sadness? And then I'm even going to ask about spirituality. And when I say spirituality, I'm not asking about a particular religion or a particular church that you go to or you don't go to. I just want to know, is there a connection? Is there a connection with the universe or with with the world at large? How do you feel about that? Because that's really important. The treatment goals, I've said them over and over again. We want to correct anything that promotes the cancer, try to reduce the risk of progression of that cancer, support everyone going through treatments, educate, educate, educate. And just always remember, you're not doing this by yourself. There's a lot of people out here. As I tell my patients, I do an after visit summary for all of my patients. And one of the last things I tell them is that you're not on your own. There's a lot of people who want to help. Sometimes they don't know how. Sometimes it's people you would never expect. But sometimes if you just reach out and say, hey, you want to go for a walk? Hey, you want to, I don't know, go, have a lunch or a dinner, or do you just want to talk? You just want to watch a movie together? People are willing to help. They just need to know what you need. So there's so much more I could talk about. I want to end with this. This is one of my favorite things. It's something we came out with at one of my previous practices. We called it the 4 pillars of wellness. And these are things that no matter what's going on in your life, I think this is important. So eat well. And what eating well does include adequate hydration. Make sure that you're drinking enough water every day. If you are living in a place where you have reverse osmosis water or something like that, make sure you're adding electrolytes back, whether it's the emergency brand of, it's called electroreplete or something to that effect. There's something called Nuun, Nuun, which is a little capsule that you just put in your water, and it's adding electrolytes and nutrients back into your water. So making sure that you're getting enough water every day. My rule of thumb is half your body weight in ounces a day within reason. So eat well. Connect deeply. This is about friendship. This is about spirituality. This is about community. Don't sit and be alone all the time. That's not what we were meant to do. Really reach out, join groups, join support groups if that helps you. Stress less. I know that I'm not supposed to tell people that, but this is just a way of saying, look at your stress management. Look at your sleep hygiene. Are you getting the sleep that you need every day? Your self-care, mindfulness. One of the things with mindfulness that I ask my patients to check out is on the phone. There's an app called Calm, Calm. The Calm app has little meditations that you can do. There's a free version and there's a paid for version. But what I love about it is that you can set up reminders on the app. So every day at 6 p.m., I have my Calm app ask me if I want to check in and how was my day. That the other thing that it does is it gives you meditations. And people think that meditation has to be like an hour or a half an hour of sitting there, chanting or doing something. This app allows you 10 minutes. We can find 10 minutes at any time during the day to just sit and breathe and listen to the meditation. And it really is very helpful. The other pillar of wellness is move more. So stretching, movement, exercise, yoga, Tai Chi. Tai Chi is a fabulous thing to do just to get yourself going. If you're a team sports player and you're able to do it, I really do encourage it. The one thing that's missing on my 4 pillars of wellness is something I always add back in, and it's practice kindness. We need to be more kind to one another. We need to be more loving to one another. And just keeping that in mind with everything you do, I think is very important and does help us stress less and connect deeply. So that's it. Thank you so much for listening. I work like I said, at the UCI Susan Samueli Institute. We have a brand new building. It's gorgeous. It's in Irvine, California. That's the contact information and the phone number. So thank you again for your time. I appreciate it.